So another hip exercise you'd see is standing hip at abduction, where you would do this. So it's in standing. You do want to specify that in your flow sheet. A lot of people, kind of like when they're on their side, they'll bring their leg in front of them. You don't want it in front of you, you want it in your side. And it might feel like it's behind them, but you want it at their side. You should be feeling it right in that area. So standing hip abduction. And you can progress this with a band around their ankles. Some people will also put an ankle weight on their ankles. What you want to think of is, though, what is the most appropriate and what your therapist desires. When you have a band, it gets harder the further you get away, but you're also weaker the further you get away. So you need to consider that, but it gives you resistance throughout the full motion. But when you have an ankle weight, the weight is resists you for gravity. So when you have an ankle weight, it really is only challenging the ability to lift the leg up. So it's easier than a band would be. So maybe for the older patients, you might consider that ankle weight a little bit more than the band, but you might do the band. So just kind of consider that as the therapist requests it. Another tip with standing hip abduction is they may feel it on this side, even though they're doing this. And they'll be like, well, I feel it here. Why don't I feel it here? That's because this leg is stabilizing them. They have to put all their weight on this leg in order to lift this. So all of these muscles that hold you up whenever you walk and things are all working. So they might feel it on this side. So I usually recommend people doing this with both legs, even if they're here for a total hip on the left or back pain or pain in the left hip. I'll have them do it with their right, because these are still working when you're lifting this. And then be conscious of, does the therapist want them to hold on or not? If they want to work on balance, then they might not want them to hold on. But if it's really challenging, they might want them to hold on. So make sure that you're aware of that as well. A compensation people commonly do with hip abduction is they'll go like this, which you're still working this, but you're not working this anymore, stabilizing. So you do want to make sure they are upright, because then these are having to hold them upright. Because otherwise they do this, that turns this muscle off, and you're not having to work. You'll see it commonly with total hip. So if someone has a total hip on the left and they're coming here for rehab and we're having them do this, first of all, they might hike up the hip first. The other thing they might do is this when they do the other side. And then they're not working this. So make sure you correct them to be standing on that leg upright as they lift this leg. So standing hip extension is another exercise where you would just go backwards like this. Now a lot of people they'll lean forward, then they're not getting the motion at their hip. That's more the back. So be aware of that. Try to correct them to be standing upright, but they might have limited motion in their hip, in which case, in order to try to get their hip back, they're doing this, and then their back's gonna hurt. So just be conscious of how they're doing it, really focusing on getting that leg behind them at the hip joint, not this or not this. And ideally they're feeling it right in that butt or in this leg to stabilize.